Okay guys, Timmy coming at you again here. Today what we're going to do is we're going to go over cancer. So before I can go into too much detail about it, I got to give you a little background information. First of all, you got your cell. And inside cells, inside the nucleus of the cell, you have DNA. Now, every cell of your body that contains a nucleus and contains DNA has all the DNA necessary to make every single protein in your body. So, if you look here, the structure of DNA involves these things called nucleic acids. And as you learned in anatomy and physiology, right, you have 4 nucleotides. You have adenine, thymine, cytosine, and guanine. And there's an obligatory base pairing that goes with DNA. So as you can see, you have one side rail of DNA and then you have another. And what creates that double helix is that obligatory base pairing. Now, and the reason you have it in a double helix is because it allows it to be much more stable, less likely to be damaged. And again, the body does stuff that makes sense. So, and this is really important. Sections of DNA, I'm going to say that again. Sections of DNA that code for a particular protein are called genes. And the human genome has about 25,000 individual genes, and they're going to code for different proteins. Now, again, the body does stuff that makes sense. DNA codes for all the proteins in the body. So you don't want your DNA damaged. So the nuclear envelope protects the DNA. And only things that are supposed to enter the nucleus or leave the nucleus will be able to do that through these little small holes in the nuclear envelope called nuclear pores. So again, this is another, like a secondary defense that the cell uses. Now, if we look, a section of DNA that codes for a particular protein is called a gene. And cells that are capable of dividing, some cells aren't capable of dividing. When you have a mature red blood cells don't have a nucleus, they don't have DNA, and therefore can't replicate themselves. So white blood cells do have a nucleus. They got DNA, so they can replicate themselves. That's why your white blood cell count goes up when you get an infection. Now, when we're talking about cells dividing, there are 3 genes of the 25,000, and each gene is located, and I'm making this up, on a different section of DNA. And these 3 genes control cell division, or how fast the cell divides. One of the genes that controls cell division, or how rapidly a cell divides, is called the proto-unco gene. And that gene, when it's turned on, it will tell the cell to begin to divide. One cell becomes 2 cells. Now, there's another gene in a different section of DNA that tells the cell to stop dividing. That's called the tumor suppressor gene. these two genes work together to determine how rapidly particular cells divide. Now look, some cells in your body divide more rapidly than others. Bone marrow cells, right? Skin cells, the lining of your GI tract. All of those cells divide rapidly. So that's why you use a loofah sponge or loofah, whatever, to exfoliate your skin, because as the new cells from the lower layer of the skin divide, they're pushing up those previous skin cells to the top, and those are dead, so you slough them off. And when you go to the bathroom, when you take a dump, not only are you crapping out your fruity pebbles, but you are also crapping out the lining of your GI tract. And as we know, hair is highly keratinized skin cells. So when your hair falls out, then the skin cells replicate and grow a new piece of hair. Most days. For me, it stopped doing that about 15 years ago. Anyways, now, there's another gene. I'm making this up again. I'm saying it's right here. Because we damage our DNA, right? We're exposed to stuff that can mutate our DNA. So if you mutate your DNA, then you're going to make bad, goofy proteins, and that can cause the cells to die, or at least not perform their function. And that gene is called, oddly enough, the DNA repair gene. So it will march up and down the entire strand of DNA looking for bad or missing nucleotides, nucleic acids, and it will fix it so that you keep that DNA pristine the way you got it from mommy and daddy. Alright, here's the other thing. Because genes code for proteins, some of the proteins that a particular cell makes are what I like to refer to as recognition proteins. So here are these little proteins embedded in the cell membrane, and what they do is they allow like cells to stick together. So I'm making this up. Here you got a liver cell, and here you have another liver cell. Because they're both liver cells, they're going to have embedded in their cell membrane these little recognition receptors that allow like cells to stick together. Now, this is normal cell division, and just like you, when you were little, you were a baby, you were immature. Then as you grew up, right, you matured. So when cells divide, right, they mature because the rate of cell division is slow, and they develop these recognition receptors. That's what allows them to stick together. Now, in people with cancer, this is what's going on. In order to get cancer, and again, I'm simplifying this incredibly. It's much more complicated than I'm letting on. But three things have to happen. Again, if this is a gene, here this is the proto-oncogene. Then you have the tumor suppressor gene, and then you have the DNA repair gene. Right? Now look. In order to get metastatic cancer, cancer that spreads to distant parts of the body, three things have to happen. You have to damage or mutate your proto-oncogene, and if you mutate it, it will become oncogene. So instead of dividing at that normal set rate, it will begin to divide out of control. Well, You got your tumor suppressor gene that can say, hey, easy there, big fella, stop dividing. Well, guess what? That has to be mutated too. So the tumor suppressor gene will be mutated. Well, remember, you got the Maytag repairman, the DNA repair gene that could fix those damaged proto-oncogene and tumor suppressor gene. So this guy has to be mutated. So if all three things happen to a particular cell's DNA, that cell will begin to divide out of control. And essentially, if you think of the proto-oncogene as the gas pedal in your car and the tumor suppressor gene as your brake and the DNA repair gene as your mechanic, you have a car that has the gas pedal to the floor, the brake lines are cut, and your mechanic's on vacation. So those cells will begin to divide out of control. Now, if you look, let's look at Guy here. Alright, this is melanocytes embedded in the basal layer of your skin, have a nucleus and have the capability to divide. So if you're exposed to carcinogens like ultraviolet radiation, sunlight can damage your DNA. So what's going to happen is if you mutate the tumor suppressor gene, DNA repair gene, and the proto-oncogene, these melanocytes will begin to divide out of control. Now, and this is really important, cells that get cancer divide rapidly. We've established that. But if you look, there's two basic cell types that get cancer. And again, I'm being kind of generic here. Cells that divide rapidly and cells that are exposed to bad stuff, carcinogens. Now, again, this is real important. Any part of the body that is open to the environment has a huge lymphatic supply, because one of the functions of the lymphatic system is in immunity, right, to destroy potential things that are trying to enter the body. Parts of the body that are exposed to the environment have this huge lymphatic supply. So cancer spreads in usually two big ways. Number one, it will spread through the lymphatic system. That's why in breast cancer, and breasts are open to the environment, right? The nipple's open. How does the milk get out, right? If it's not. So that's why when a woman is suspected of having breast cancer, what they will do is they will do what's called a sentinel node biopsy of the axillary lymph nodes. And if they find randomly cancer cells present in the axillary lymph nodes, then this woman has to undergo a radical mastectomy. Because if you have one cancer cell left, you still have cancer. The other way that it metastasizes or travels to distant parts of the body is through the bloodstream. So any parts of the body that have a huge vascular supply, blood vessels, arteries and veins, and a huge lymphatic supply, those are the types of cancers that are typically most devastating, because it allows cancer cells to spread rapidly. Okay, so let's take a quick look at this video here. I'll actually quicken it up. So I'll narrate this. There's dude, he's looking, and he looks at a mole, and he says to himself, that ain't right. So we dig a little deeper. So he was maybe out in the sun and damaged the DNA of these melanocytes and damaged the proto-oncogene, tumor suppressor gene, and DNA repair gene. So what that's going to do is that's going to cause these cells to begin to divide out of control. Now, this is really important. What do mature cells do? They grow up and they develop recognition receptors, so they know to stick together. One of the hallmarks of cancer, right? Cancer, is that cancer cells divide so rapidly they never mature. And if they don't mature, they don't develop recognition receptors. So they don't know that they should be hanging out with these guys. And what that does is that allows them to break away from the primary tumor. And as you can see, the skin has a huge lymphatic supply and blood supply. So these tumor cells can enter the lymphatic system and travel to distant parts of the body. That's metastasis. There you have it, right? Traveling through the lymph nodes. So, what do? Well, you don't get cancer. How do you not get cancer? Well, you don't get exposed to bad stuff. And just so you know, reading the textbook reduces your risk for cancer, any type of cancer, by a factor of, I think, 1.375 times less likely to get cancer if you read the textbook. Now, I know this drawing's kind of stupid, but tough. If you look at all terminal cancer patients, they all look the same. They are emaciated, right? They are skin and bone, and their skin is gray, ashen, right? And here's why. Here's some healthy cells, right? The normal cells of your body. And here are the cancer cells. This is very important. At no other time in a cell's life is it more metabolically active than when it is dividing. It consumes a ton of energy to divide a cell. So watch as the cancer begins to spread and there's more and more cancer cells, the cardiovascular system is going to divert blood flow to the most metabolically active parts. And that, unfortunately, when you have cancer, is the cancer cells. So what's going to happen? Blood that would normally go to the healthy cells of your body is not going there, and it's being diverted to the cancer cells. So what happens your skin becomes dusky, right? Pale. And what did I tell you about cancer cells? They are the most metabolically active cells you have in your body. And you cannot eat enough to keep up with the metabolic demand of these cancer cells. So what happens is you start digging into your fat stores for those cancer cells to make ATP so that they can divide. That is why one of the symptoms of cancer is unexplained weight loss. That's why every day, or not every day, but every time you go in for a physical, a doctor will look at your weight. And one of the reasons they want to look at that is if they see a sudden, dramatic weight loss that's not intentional, like you didn't go on Atkins for 8 months, then that is always a potential sign of cancer. So that's why they get the dramatic weight loss. Now, when you have cancer, what are you going to do? You are going to try to kill it. So what's the definition of cancer? It's uncontrolled, unregulated cell division. Your own cells of your body are dividing out of control. Well, we have this going on, right? We have these cells that could potentially be rogue, right? The little renegade cells that could potentially cause cancer. But watch, when your cells start making goofy proteins, white blood cells are programmed to attack them and destroy them, right? The problem is in cancer is that the cells divide so rapidly, right? Hang on. These cells divide so rapidly that your immune system, your T cells, B cells, NK cells, natural killer cells, can't keep up with it. The other hallmark of cancer is that it needs stuff in the blood in order to continue to divide. So what cancer cells tend to do is they tend to send out these little feelers, these little extensions of the cell membrane, and because they're looking for a blood supply. That's why if somebody has a tumor, one of the questions that you can ask is, can you move it? And if you can't move it, then that needs to be evaluated, because tumor cells, cancer cells, grow towards a blood supply, so they anchor themselves into the surrounding tissue looking for that blood supply. Benign tumors, on the other hand, that are not cancerous, they divide at a normal rate and they mature, right? So they develop recognition receptors. The problem is they just don't stop dividing, and essentially there's damage to the DNA repair gene and the tumor suppressor gene. The proto-oncogene is telling those cells to divide at a normal rate, grow up, develop recognition receptors, but the tumor suppressor gene isn't telling them to stop dividing. And because the cells are dividing and maturing, your immune system has time to look at that and say, hey, buddy, knock it off. So I don't know what you're doing. You're me, so I ain't going to mess with you too much. So what I'm going to do is I'm going to encapsulate you. I'm going to put a little protein coat around you. And because there's that little protein coat around it, it's not digging into the tissue to find a blood supply. So that's why they're freely movable. And again, that's a very, very basic general rule of thumb. So in chemotherapy, basically what chemotherapy does is, I don't want to write it out for you. And it's real simple. What's your problem? You have cancer, so that's uncontrolled cell division. particular cells of your body are dividing out of control. So chemotherapy, right, chemicals that they will you either take orally or they will give you intravenously, prevent rapidly dividing cells from dividing rapidly. That's how chemotherapy works. And there's different ways of attacking the cell to prevent it from dividing. But that's what I want to get from this. So for my advanced class, Advanced Anatomy and Physiology, you can stop the video there. For my pathophysiology class, I'm going to go on a little bit. Okay guys, for my pathophysiology class, a couple of things, right? Number one, the difference between benign and malignant. If you look, right, and if you look at the if you look at the differences and similarities between benign and malignant, and again, benign, they divide normally, but they just don't stop dividing. Malignant is they divide incredibly rapidly. They don't develop those recognition receptors because they don't have time to mature. That's why in some cancers, the doctors will say to you, look, we don't know where the primary tumor is, where this cancer began, because the cells are so undifferentiated. So in terms of growth rate, malignant rapid, slow for benign. And then cancer cells infiltrate because of the lack of recognition receptors, while benign tumors just simply expand. They're kind of encapsulated, and the tumor remains localized in benign tumors. And because of no recognition receptors and that rapid cell division, it will metastasize or spread via the lymphatic system or bloodstream. And the cell differentiation in benign, well differentiated and poorly differentiated, meaning they don't look anything like the primary tumors. So when malignant, poorly differentiated because they haven't grown up, benign, they look like the other cells of that particular tissue that it originated in. So that's really the difference between benign and malignant. And know this, benign tumors are still bad, depending on where they are, right? So if you have a brain tumor, right, it's benign, but because the skull is fixed, it can begin to compress blood vessels or and damage other parts of your brain. So benign tumors are not always fun. So what do we do? So let's look at the staging of cancer, really. So they give you stages, right? And know this, the lower the stage, the better the outcome in most cases. The more advanced the stage, the poorer the outcome. So let's look at this. In stage 0, right? Stage 0. You have cancer cells, but they are isolated to that particular tissue type, right? So it's beginning, it's the early stage of cancer, and it's isolated to a particular tissue. In stage 1 and stage 2, there is expansion, infiltration. The cancer has now, no longer is it isolated to one tissue type, it is now spreading to the different tissue types. So that's stage 1, and stage 2 is just increased expansion. Stage 3, right, that is where it is now in the lymphatic system or the bloodstream. And stage 4 is where those cancer cells that infiltrated the bloodstream or the lymph nodes, lymphatic system, it is now spread to another tissue distant from the primary tumor. And again, as you move farther along the stages, the outcome becomes poor. That's why they do screening tests for cancer, colorectal screening, mammography, right? When you go into the doctor, you should take your clothes up, get into a gown so a doctor can do skin surveillance. Skin cancer will kill you just like any other cancer, so that's not to be taken lightly. The good thing is that you can see your skin. But a lot of skin cancers, melanomas and carcinomas, they develop on the back, right? And how many people look at your back? Not that many. So those are the stages of cancer. Now, what I want to do for you, let's go over some of the signs and symptoms of cancer. All right. So again, unexplained, an unexplained mass or lump. And again, this is a generalized rule that if you can't move it, it's fixed within that tissue. That needs to be followed up even more, because remember, cancer grows towards a blood supply, so it will dig down into the tissues. And pain associated with that. As that begins to expand, it can put pressure on sensory nerves, and you get pain. And then another one is unexplained bleeding or discharge, right? Had a buddy of mine, he had like green goop coming coming out of his nipple, and he had breast cancer. And then another one is a change in bowel or bladder habits. You become constipated, or your stool, instead of it being like a nice good sized turd, it becomes kind of strippy, like a piece of beef jerky. That could be that the tumor is growing and then blocking the passage of fecal matter, right? And then the other big one is unexplained weight loss. And each cancer will present itself in a slightly different way. So, but these are the things that you look for. And with respect to cancer, the most important in terms of treating cancer is to prevent it from occurring. That's why regular screening exams and routine physicals. And you also look at history. With respect to cancer, there's a strong genetic component, like the BRCA1 and BRCA2 gene for breast cancer. And some genes just spontaneously mutate and can cause cancer. You can't explain it. Can't explain it. So those are really the clinical manifestations, the signs and symptoms of cancer. So how do you diagnose it, right? How do you diagnose it? Well, again, the way to do that is early detection. That's why routine physicals and screening tests, again, mammography, chest x-ray, colonoscopy, physical, you doing a self-breast exam, or in the case of males, testicular exams. But really, they can do it through imaging, and they can do it through some blood tests. Now, I want to try to explain this to you. you do good in this class, and I'm hoping that all of you do good in this class, if you get a good grade on a test, what do? You hang it on your refrigerator. So you have a healthy cell here, right? And what do? They hang their proteins on the surface of the cell membrane. Cancer cells do the same thing, right? They will hang some proteins, goofy proteins, mind you, on their cell membrane. And these proteins can break off and they can enter the blood because they're proteins and they can produce an immune response. These are called antigens. Now, because a cancer cell doesn't divide very rapid, or does divide rapidly, and it doesn't mature and develop those recognition receptors, then as the cancer cells increase in number, the amount of this antigen is going to go up in the blood. So what they do is they look for that particular antigen. So you have probably heard of carcinogenic embryonic antigen, CEA, and that is used for to help diagnose ovarian cancer, breast cancer, lung cancer, pancreatic and GI cancer. So it's called CEA 125, right? There's another antigen called CA 15-3, and that's a little more specific for breast cancer. And then you have, of course, the prostate specific antigen for prostate cancer. Now, a couple of other things. In some lung cancers, the cells divide out of control. They're goofy. They're making goofy proteins. One of the things that lung cancer cells can produce is the hormone ACTH, adrenal corticotropic hormone. That's the hormone that's released from the pituitary gland to stimulate the adrenal gland to release cortisol. So one of the things that physicians have to check for if a person comes in kind of exhibiting signs of Cushing's syndrome is they will check for lung cancer, because lung cancer cells produce ACTH. Now, look, I'm not saying that this is the be-all and end-all for detecting cancer, right? It's just a tool. The other thing, again, they're going to look at history and physical, right? What is the patient complaining about? And then use imaging tests, CAT scans, MRIs. CAT scan, right? You can't routinely give somebody a CAT scan because you're exposing this person to radiation. So the other imaging tests that they can use, so you can use a CT scan, right? Because that will look for masses. You can use an MRI. MRI is usually good for tissues that have a lot of water, like your brain, central nervous system, to look for tumors there. It doesn't expose you to radiation as well. They can use ultrasound, and this is kind of important, right? A cyst is kind of like basically a growth, a benign situation, as opposed to a tumor, right? Cysts, many of them are fluid filled. Tumors are solid. So an ultrasound can detect if you have tumor or tumors, whether they're fluid filled or they're solid. So that can give you some additional information. So the blood tests, real quick, you're not going to have go in and say, look, I want to see EA125 to see if I have ovarian, breast, lung, pancreatic, or GI cancer, right? Because you may in fact have cancer, but that test is not specific enough, right? Because it looks for all types of cancer. So now you set this whole thing into motion, and it could be a mess. Many of these blood tests are used to track the treatment of cancer. So you got cancer. Let's say you got, colon cancer, right? They're going to be giving you chemotherapy, and what they want to do is they want to see how much of this stuff remains. So these blood tests are really pretty good for helping to monitor how well that chemotherapy is working. So if it's starting to go down, then you are destroying more of these cancer cells, and they're not releasing as much as of that particular protein into the blood. The other test that they use is called a PET scan. And a PET scan takes advantage of the fact that cancer cells are the most metabolically active. So it stands for positive emission tomography. Now, watch. Yeah, a little heart here. I'm going to try and draw this really good. Many of you know this, and if you don't know it, you're going to know it now. Right? You got healthy cells, the rest of your body. And then you have cancer cells. Again, at no other time in a cell's life is it more metabolically active and therefore demanding more stuff from the blood than when the cell is dividing. Now, cancer cells, just like every other cell in your body, it has to produce ATP, right? It's got to produce energy. So the byproducts of metabolism are going to be carbon dioxide, hydrogen ions, heat, ADP, right? These byproducts of metabolism will cause the arteries that supply the cancer cells to dilate. And because the rest of the cells of your body, your healthy cells, aren't as metabolically active, those blood vessels will remain smaller, and the metabolically active parts, cancer cells, will be dilated. So when your little left ventricle contracts, the vast majority of oxygen and nutrients is going to go feed the cancer cells. Now watch. We're going to learn about this, so don't you worry. In a PET scan, what they do is they start an IV and they inject you with a glucose that is labeled. Right? It's a little tracer. So now watch. What cells of the body are most metabolically active? Cancer cells. When you inject this labeled tracer glucose, it's going to cause your blood sugar to go up, and that's going to cause your pancreas to release insulin. When your blood sugar is elevated, glucose becomes the most readily available fuel for the cells of the body to use to make ATP. But in the case of cancer, right, because the cells are so metabolically active, the vast majority of that glucose is going to go to the cancer cells, and it's going to enter the cancer cells. And when you do the positive emission tomography scan, it's going to light up. And the dark spots here show where the cancer is present. So a PET scan also helps you identify the locations of cancer, and it will also help you identify if cancer has spread. And PET scans can also be used to track the course of treatment, chemotherapy and radiation, to see if these dark spots are going away. Now, the other thing, and the most definitive test again, is the biopsy. Basically, biopsy, look at life. So what they will do is they will find the tumor, and they will remove part of that tumor, and then they will look underneath the microscope to identify, if they can, the cell type. And again, with really aggressive cancers, they divide so rapidly and they never mature that it's hard to determine where the cancer actually originated from. So those are the tests that you use for diagnosing. Okay, the other thing I want to do for you is to classify tumors, right? So benign tumors, they tend to be described as polyps or papillomas, right? So you take the tumor of origin and add oma to it. Malignant, on the other hand, what they're talking about is the tissue type that it originated in. So if you have a carcinoma, carcinomas are cancers in tissue that line body cavities. Tissues of glands, they tend to be adenomas. Right? Glandular tissue. Then you have sarcoma. Sarcomas are cancers of connective tissue. Muscles are connective tissue. Blood, connective tissue, but there's a further classification. There's a condition called rhabdomyosarcoma, and that is cancer of skeletal muscle. It is a rare form of cancer and usually strikes kids before the age of puberty. After that, skeletal muscle goes into what's called a G0 phase of the cell cycle, so it can't divide anymore. In order to get more muscle, the existing muscle fibers, they just hypertrophy as opposed to hyperplasia, right? Hyperplasia, division. Hypertrophy, cell just increases in size. Alright, and then a couple of things here, just a couple of things. Some terms. Cancer in situ, what does that mean? Cancer in vivo, what does that mean? Cancer in situ means that the cancer is isolated to a particular tissue that it originated in. Cancer in vivo, vivo means life. Vivo Las Vegas, bright light city. So we know which one is worse. So cancer in vivo, if you see it on a lab sheet, that's never good. So what can you do for cancer? Well, the treatment really depends on the location of the cancer, the degree of metastasis, and more importantly, the overall health of the patient. And again, chemotherapy works primarily by preventing cells from dividing. Another form of chemotherapy works by cutting off blood flow to the tumor. So there are these newer chemotherapeutic agents called anti-angiogenic factors or inhibitors. Basically what they do is they prevent the cancer cells from releasing chemicals that allow blood vessels to grow towards it. And if you cut off the blood supply, you'll kill the cancer. Now, radiation, on the other hand, is kind of interesting. Radiation can cause cancer, but it can also be used to treat cancer. One of the things that a cell has to do before it can replicate itself is it has to make an exact copy of its DNA. So what radiation does is radiation destroys the cancer cell's DNA. If the cancer DNA is destroyed, then it can't replicate itself, and therefore it can't divide. So radiation has to be precise in terms of where you are giving that person that radiation. So that's why you'll see people who maybe have brain cancer that their head is actually locked in a little halo to prevent them from moving, to isolate that radiation. Then you have this little, what's called brachyradiation. This is where they implant seeds, and these are radioactive, and they emit localized radiation to the tumor. So it's usually placed in the original tumor, and then once it's destroyed, those things are removed. Now, the DNA from replicating, right? Or you can just damage the DNA and destroy it. So that's one and two. And then you can prevent the process of cell division. So you have, if you remember from general and advanced, you have these little centrioles. And in order to separate the chromosomes to make the two cells, you got to throw out these little mitotic spindles, little fishing lines to separate them. So there's drugs out there that will prevent those little fishing lines from being formed. If you can't separate the chromosomes, you can't divide the cell. You can prevent the blood vessels from growing. There are those anti-angiogenic inhibitors. Just a couple of drugs that you probably heard of, right? Methyltrexate, that prevents the synthesis of folic acid, which is required to make nucleic acids. And as we know, DNA is made from nucleic acids. And then 5-FU, that's kind of rude, prevents the synthesis of thiamine. And without thiamine, you can't replicate your DNA. So what scientists are doing is they're trying to isolate and find differences between cancer cells, processes inside a cancer cell that's different from the normal cells, because chemotherapy is pretty stupid. So not only will chemotherapy prevent cancer cells from dividing, but this is really important, it will also prevent normal cells, normal healthy cells from dividing. Right? And what cells of your body divide rapidly? Skin cells, hair cells. So that's why if you're on chemotherapy, your hair falls out and it don't grow back. Why do they lose weight even more and get nauseated, vomiting, diarrhea? The lining of your GI tract turns over every 3 days. So if you're on chemotherapy, you're going to lose that lining you had, but you won't be able to make a new one. And the body does stuff that makes sense. So if you can't replace that GI tract with nice healthy cells to help you digest and absorb food, the body's going to get rid of that food. That's why they get nauseated and vomiting. Also, these drugs themselves, these things are toxic. Here's the other thing. Some cancers are hormone sensitive, meaning these hormones, there's actual receptors on the cell membrane of these cancer cells, and these hormones will actually make the cancer worse. So cancer cells like in breast cancer, prostate, ovarian, endometrial cancers, there's medications out there that can block these hormone specific receptors in these cancers that are hormone sensitive. You probably heard of tamoxifen, yeah? So those are some of the drugs used to treat it. The other thing that can be done is surgery. One of the things that physicians will do is they will try to remove that, at least the primary tumor. One of the reasons you want to do that is, depending on the location of the cancer, that can improve the person's quality of life regardless of how much time they have left. An example, if you got a big mass in your lung and it's preventing you from getting enough oxygen, and then they can go in and remove that tumor. The other thing is that cancer cells will release chemicals that will actually erode blood vessels. So some of these people can actually bleed to death because of the cancer. So that, I think, covers all the stuff on cancer. So, hope you learned something, and if you have any questions, let me know.